Today, we're delving into the foundational concepts of mental health nursing, drawing from the comprehensive insights provided in Basic Mental Health Nursing Concepts. This material outlines the essential approaches and standards that guide nurses in providing care within mental health settings.
That's right. The core of mental health nursing care is anchored by standards set by organizations like the American Nurses Association, the American Psychiatric Nurses Association, and the International Society of Psychiatric Mental Health Nurses. Nurses aren't just following a checklist, they're integrating the nursing process with a truly holistic approach.
Holistic care often gets mentioned, but what does it specifically mean in mental health? Are we talking about biological, social, psychological, and spiritual aspects?
Precisely. It means considering all those dimensions for every client. The assessment phase is crucial, employing observation, interviewing, physical examination, and collaboration. It's not just about a one-time check-in. Every interaction involves ongoing assessment.
So, even a physical assessment has a place here. The text mentions using touch to communicate caring, but respecting personal space if the client prefers not to be touched. That seems like a delicate balance.
It is. Nurses must be sensitive to nonverbal cues and client comfort. During physical assessments, questions about difficulty sleeping, incontinence, falls, depression, dizziness, and loss of energy are critical. And it's important to get a detailed medication history and, whenever appropriate, include family or significant others.
Beyond the physical, the psychosocial history sounds incredibly insightful. How a client perceives their own health, their beliefs about illness and wellness, their leisure activities, substance use, stress levels, and coping abilities, these are all significant pieces of the puzzle.
Absolutely. It allows nurses to build a comprehensive picture. And building on that, cultural beliefs and practices are non-negotiable. Nurses need to assess and express interest in a client's culture, integrating it into the care plan. Ignoring it can lead to stereotyping or stigmatizing.
Can you give an example of how cultural factors might impact mental health care?
Certainly. Consider dietary needs for culture-specific foods, particular healthcare beliefs, or how a mental health diagnosis is viewed within their culture. The text states, quote, "The nurse's awareness of culture alleviates stereotyping and stigmatizing," end quote. Sometimes a trained interpreter is essential for effective communication.
And how do spiritual and religious beliefs fit into this holistic framework? The text distinguishes between spirituality as internal values and purpose, and religion as organized worship and rituals.
Both profoundly affect how a client finds meaning, hope, and peace. Nurses assess support systems and can help clients identify support persons or resources, even assisting in locating a spiritual or religious leader if needed. It's about respecting that internal framework.
So, when a nurse conducts an initial interview, the priority is identifying the client's perception of their mental health status as part of the initial assessment, according to the text.
That's correct. The text explicitly states, quote, "The first action the nurse should take when using the nursing process is assessment. Identifying the client's perception of their mental health status provides important information about the client's psychosocial history," end quote. It sets the stage for everything else.
Moving to the Mental Status Examination, or MSE, the text outlines different levels of consciousness: alert, lethargic, stuporous, and comatose. For a stuporous client, it mentions requiring vigorous or painful stimuli. That sounds quite intense.
It is, but it's a critical indicator of neurological response. Documentation includes observed behaviors for each level. The MSE also assessed physical appearance, looking at hygiene, grooming, and whether the client looks their stated age. Behavior covers voluntary and involuntary movements and eye contact.
And the distinction between mood and affect: mood is what the client feels, but affect is the objective expression of it.
Precisely. Mood is subjective. internal. Affect is the observable expression, like a flat affect or lack of facial expression. Then we assess cognitive and intellectual abilities, orientation to time, person, and place, memory, immediate, recent, and remote, and general knowledge. Asking about visitors from the current day assesses recent memory, while a verifiable past fact, like a birth date, assesses remote memory.
The critical text gives some very specific examples for assessing cognitive abilities, counting backward by sevens to gauge calculation, and asking how cars and trains are similar to assess abstract thinking. It also stresses sensitivity to cultural or language differences here.
Yes, those are classic examples. For judgment, a nurse might ask a hypothetical question, like, what would you do if there were a fire in your room? The client's response indicates their logical reasoning, and speech quality, rate, volume, meaningfulness, articulation is also evaluated.
So if a newly licensed nurse says they'd count backward by sevens to assess cognitive ability, observe facial expressions for affect, or have a client write a sentence for language ability, they're demonstrating understanding of the MSE.
That's correct. Those are all appropriate techniques as described in the text. However, asking a client to repeat a list of objects assesses immediate memory, not remote memory. And asking about recent presidents assesses cognitive knowledge, not abstract thinking.
Beyond the MSE, there are standardized screening tools. The text mentions the Adverse Childhood Experiences Questionnaire, the Brief Patient Health Questionnaire, and the Mini Mental State Examination, or MMSE. What's the main purpose of these?
They provide objective ways to evaluate and monitor clients. The MMSE, for example, specifically assesses cognitive status by looking at orientation, attention span, calculation, object recall, and language skills. There are also various pain assessment tools, from visual analog scales to the McGill Pain Questionnaire.
And care differs significantly across the lifespan. For children and adolescents, their caregivers often provide crucial information alongside the client. The text notes that mentally healthy children trust others and interpret their environments accurately.
It also highlights the challenge that mental health and developmental disorders aren't always easily diagnosed in this group. They might lack the skills to describe what's happening, and, quote, a wide variation of normal behavior, especially in different developmental stages, end quote, can complicate assessment. The HEADS SSS standardized assessment tool is specifically used here.
HEADS, what does that stand for?
It's an acronym for home environment, education or employment, activities, drug and substance use, sexuality, suicide or depression, and safety. It provides a structured way to cover critical areas for younger clients.
And for older adults, the assessment expands even further to include functional ability, economic and social status, and environmental factors like stairways in the home. Specialized tools like the Geriatric Depression Scale are used.
Absolutely, and communication techniques are vital. The nurse should use a private, quiet space with good lighting for vision and hearing, introduce themselves, and sit at the client's level, never standing over them. These seemingly small things make a huge difference in establishing trust and getting accurate information.
This ties into social determinants of mental health, or SDMH, which the World Health Organization identifies. These are the ways people live and work that shape their health outcomes, often rooted in health inequalities.
Yes, while similar to general social determinants of health, mental health solutions sometimes require a different approach due to specific disparities in access and treatment. It's about understanding the broader context of a client's life.
And trauma-informed care seems to be a proactive way to address some of those disparities. Nurses screening for interpersonal violence and trauma to understand current behaviors and relationships. The text mentions 4 R's: realize, recognize, respond, and resist.
It's about realizing trauma's widespread impact, recognizing its signs, organizing responses, and crucially, resisting re-traumatization. It's a foundational lens for all care.
When it comes to actual diagnoses, the Diagnostic and Statistical Manual of Mental Disorders, 5th edition text revision, the DSM-5-TR, is mentioned, and then there are NANDA diagnoses for nursing interventions.
The DSM-5-TR is for mental health professionals to diagnose using standard criteria, providing expected assessment findings. Nurses then use NANDA diagnoses to guide their specific interventions, like administering medications or monitoring adverse effects, which falls under psychobiological interventions.
So the DSM-5-TR helps nurses understand the disorder, while NANDA helps them plan the specific care they'll provide.
Exactly. And for clients with serious mental illness, these are severe and persistent conditions, often lifelong, with remissions and exacerbations impacting activities of daily living.
The impact of role and life changes also seems significant, from expected retirement to unexpected illnesses. Nurses need to assess how clients adapt and cope.
That's vital. They look at health status, living arrangements, personality factors, and even community resources. Successfully adapted clients can identify positive coping behaviors and use stress reduction techniques.
Finally, the text outlines various therapeutic strategies: counseling with communication skills, milieu therapy to ensure a safe environment, screening for risks like suicide, promoting self-care, psychobiological interventions like medication monitoring, and cognitive and behavioral therapies such as systematic desensitization. It's a comprehensive toolkit.
It truly is, all aimed at providing holistic, individualized care, health teaching, health promotion, and case management. Coordinating medical, mental health, and social services complete the picture of what a mental health nurse encompasses.
This discussion has provided a thorough overview of the foundational elements of mental health nursing, from initial assessment and cultural considerations to diagnosis and diverse therapeutic strategies. Share this episode if you found this exploration valuable.